So hello everyone, maayong adlaw. Welcome to our discussion. For today, you will learn about the learners with difficulty hearing. So together with me, other professionals will be sharing their knowledge and expertise about the topic that we will tackle today. So allow me to introduce them to you. So yours truly, Kai Lico. We have Miss Brittany Jane Lucica, Miss Jael Miano, Miss Mary Grace Nuera, Mr. Melvin Yoren, and last but not the least, Mr. John Kevin Lumayan. So these professionals will help all of you to explore who are the learners with hearing difficulty and guide us throughout the discussion. So they will share their background knowledge, their experiences, and everything that they can share that would benefit all of us and that would give us insight so that we would be able to help these type of learners and would be able to cater their needs in all aspects. So, okay, again, our topic for this discussion is about the learners with difficulty hearing. So let me first present to you the learning objectives. At the end of the discussion, the students are expected to first identify learners with difficulty in hearing, second, indicate the causes and effects of hearing impairment, apply the coping, support, and preventions for learners with hearing difficulty, and formulate strategies to cater learners with difficulty hearing through multimedia presentation. So here are the topics to be covered. We will define what is learners with difficulty hearing, the type of hearing impairment, the age of hearing impairment, identification of learners with difficulty in hearing, what are the causes of hearing impairment, the risk factors of hearing loss, the psychological effects, the learning characteristics, the test and diagnosis treatment, the coping mechanism, benefits for treatment, prevention for hearing impairment, the general education adaptations, and teaching strategies for learners with difficulty in hearing. So now let us define what is learners with hearing difficulty. So this refers to students with an issue regarding hearing that interferes with academics. The definition from Individuals with Disabilities Education Act, or IDEA, defines it as an impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance, but is not included under the definition of deafness. Okay, when we say deafness, it is considered when hearing loss is above 90 decibels. A hearing loss below 90 decibels is called hearing impairment. So the main challenge of hearing impaired students is communication. So if the learner or the child cannot hear properly or that they have difficulty in hearing, it is difficult for them to communicate. Kaya wala man sila kadungog. So they have different ways of communicating with other people. So they would use sign language or other methods. The factors affecting the development of communication skills include their intelligence, their personality, the degree and nature of deafness and residual hearing, their family, their environment, and the age of onset. The latter plays most crucial role in the development of language, as those who have hearing loss present at birth are more functionally disabled than those who lost hearing after language and speech development. A hearing loss that occurs gradually as you age is called presbycusis. So this is very common since ang is while we are growing or while we are aging, we experience loss of hearing. So it is called as presbycusis. So it may occur, the hearing loss may occur in both ears or only in one ear. So it may occur due to the genetics, your aging, exposure to noise, and etc. Now, Let us move on to the types of hearing impairment. There are three types: the conductive, the sensorineural hearing loss, and the mixed hearing loss. So first we have the conductive hearing impairment. So conductive hearing impairment, this is caused with transmission of sounds. This refers to a decrease in sound caused by a problem in the outer or middle ear. So ang conductive hearing impairment, ang pagdungog nimo sa sound is hinay. So next we have sensorineural hearing impairment. This refers to a problem located in the inner ear. So kung ang conductive hearing impairment is caused by the outer and middle ear, ang sensorineural is inner ear, naa siya sa sod, along the nerve pathway between the inner ear and the brain. So this is caused by auditory nerve damage. Again, occurs in the inner ear or cochlea. This is often called as the nerve loss. Now, the last type of hearing impairment is the mixed hearing impairment, from the name itself, mix. So this refers to a conductive loss and sensorineural loss occurring at the same time. So it is both conductive and sensorineural. So nasa outer and ang hearing impairment is nasa inner, middle, and outer ear. So the degrees of hearing loss. So kung mild to moderate hearing loss, 26 decibels to 70 decibels loss is considered hard of hearing. So severe to profound hearing loss, ang loss greater than 70 decibels. Then separation of deaf individuals from those who are hard of hearing, 90 decibels or greater loss. And how one is able to use residual hearing is important in addition to degree of hearing loss. So I hope that you understand the degrees of hearing loss. Thank you. So now let us move on to the age of hearing impairment. We have the congenital, the adventitious, prelingual, and postlingual. So congenital versus adventitious. So when we say congenital, it is hearing loss at birth, while ang adventitious is hearing loss acquired after birth. So there's a big difference, no? Kay at birth ang congenital and ang adventitious is after birth. So next, the prelingual and postlingual. So when we say prelingual, it is the loss of hearing before speech and language develop. So before speech and language developed. While ang postlingual is the loss of hearing after spontaneous speech and language has developed. So ang prelingual before pa na-develop ang iyang speech and language, where ang postlingual is pag-develop na sa iyang speech or after spontaneous speech and language. So that is all for my assigned topic. For the next reporter, Ms. Mary Grace Mera, she will be discussing about the identification of learners with difficulty in hearing. Thank you.
Good day everyone, I am Mary Grace Nuera, and at this juncture, let us proceed now in discussing the identification of persons with hearing impairments. So Niemann, Greenstein, and David 2004 described the impact of a hearing impairment where a child can see people talking but cannot understand what is being said. So this results in the child having difficulties in understanding the world and expressing his or her personal needs, resulting in a limited interaction and social isolation. Thus, it is very important to identify the hearing impairment as early as possible. Otherwise, the child will also miss out on important educational experiences. So, to identify learners with difficulty in hearing, observe a student and see if he or she does the following items below. First will be speaking loudly. So, if you have a hearing impairment, you are less able to hear both the volume and intricacies of your voice. So this problem may cause you to speak louder quieter or in a different pitch than you have when you have a perfect hearing. Second will be positioning air towards the direction of the one speaking. So when a person has a hearing impairment, he or she has a greater difficulty localizing sound and judging how far it is. So they tend to balance their hearing towards the direction from which the sound is coming from. So we can identify person with hearing impairments if he or she position her ear towards the direction of the one speaking. Third will be asking for information to be repeated again and again. So hearing impairment affect a child's development of speech and language skills. So when a child has difficulty hearing, the areas of the brain used for communication may not develop appropriately. So this make understanding very difficult. They tend to ask to repeat the information again and again because they weren't aware that you were talking to them in the first place. So now let's proceed to the fourth one, which is the delayed development of speech. So hearing impairment, as I have mentioned a while ago, can affect the development of the children's ability to engage in age-appropriate activities, as well as affect their functional speech communication skills as well as their language skills. So they have their ways in communicating with others, such as the lip reading and sign language. So the fifth is watching the face of the speaker intently. So individual with hearing impairment faces difficulties in understanding speech from other people, and they tend to watch the speaker's lip, facial, and tongue movement as well as extrapolating from the data provided by the speaker. So that was the fifth, watching the face of the speaker intently. So the next one is favoring one ear. So when a person can only hear well in her one ear, he or she may have difficulty figuring out where the sound originated. Moreover, hearing better in one ear is not normal and should be evaluated as soon as you notice the difference. So next is not responding when called. So I believe that a lot of us can relate with this, especially in our online classes where our teachers ask us questions and we are not responding when we are called. Just kidding. So when a person is not responding when called, he or she may have hearing loss or impairment. So we must remember that someone with hearing impairment is not ignoring us and is not stupid. They may not know that you are speaking to them, especially if in a noisy environment. So one of the signs and symptoms of a hearing impairment is not responding when called. So next is has difficulty following directions. So hearing impaired person find it unusually difficult to take information and follow direction. They ask for repetition a lot, and they seem to just kind of miss things in conversation. So a child who can't hear well will struggle to keep up, may get restless and act out in class or disengage from the lesson. Next will be does not mind loud noises. Why? So people with hearing loss or impairment doesn't mind loud noises because there is no signal traveling from their ears to their brain. They will hear almost nothing. So they are less bothered by loud noises than those with normal hearing. So last but not the least is leaning close to the source of sound. So people who have hearing loss or impairment are also less able to hear both the volume and intricacies of the speaker's voice. So this results them moving close to where the sound originates. So for people with moderate hearing loss, hard and soft consonant sound become inaudible and speech become difficult to understand, particularly with background noise. So for people with severe hearing loss, some loud sounds are audible, but communication without hearing instrument or devices are impossible. So that's it, the 10 identification of persons with hearing impairments. So as a sort of review, here are the 10. First is speaking loudly. Second is positioning air toward the direction of the one speaking. Third is asking for information to be repeated again and again. Fourth is delayed development of speech. Fifth is watching the face of the speaker intently. Then next is favoring one ear. Seventh is not responding when called. Next, has difficulty following directions. Next is does not mind loud noises. And lastly, leaning close to the source of sound. So if you have one or more of the signs or symptoms that are mentioned a while ago, you can speak with your audiologist or any professional that diagnoses hearing problem. So with all of this, I can say that teachers needs to be aware of the indicators that signal the possibility that the student has undiagnosed hearing loss. On a medical note, if the hearing problem is undetected and untreated, it can cause permanent loss of hearing and long-term consequences on the quality of life of the learners. So that was it. That was all about the identification of persons with hearing impairments. That's it. Thank you and God bless us all.
Hi guys, I am Melvin Salazar Loren from Group 2 and my task for today is to discuss the causes, symptoms, risk factors, and psychological effects of hearing impairment. So, to understand how hearing loss occurs, it can be helpful to first understand how you hear. So, your ear consists of three major areas. First is the outer ear, middle ear, and inner ear. Sound waves pass through the outer ear and cause vibrations at the eardrum. The eardrum and the three small bones of the middle ear amplify the vibrations as they travel to the inner ear. There, the vibrations pass through fluid in a snail-shaped structure in the inner ear called cochlea. And attached to the nerve cells in the cochlea are thousands of tiny hairs that help translate sounds vibrations into electrical signals that are transmitted to your brain. And then, your brain turns these signals into sound. That is how we hear. So now let's go on to the causes of hearing impairment. So first is the gradual build-up of earwax or unti-unting pagbuo ng ating tutuli. Earwax can block the ear canal and prevent conduction of sound waves. So if your ears make too much wax or if earwax isn't cleared well enough, it may build up and block your ear canal, causing you nga maglisod taog, dungog. And did you know that the earwax blockages often happens when people try to get earwax out on their own by using cotton swabs or other items in their ears? So using cotton buds isn't advisable sa mga doctors. Kaya imbis nga makuha, musansan manon siya mo na nga na ay may tabo nga earwax nga mamuo sa ilawom. This usually just pushes wax deeper into the ear rather than removing it. So again, gradual build-up of earwax or unti-unting pagbuo ng ating tutuli is one of the possible cause of hearing impairment. So next is the ear infection and abnormal growth or tumors. In the outer or middle ear, any of these can cause hearing loss. There are instances that our ears may have cyst, and cyst occurs when the oils are produced in a skin gland faster that they can be released on the gland. And benign bony tumors, one of the tumor nga possible nga motubo sa atong dunggan, are caused by excess growth of bone. Repeated exposure to cold water may increase the risk of benign bone tumors of the ear canal. and its possible complications include hearing loss if the tumor is large. Mao to, abnormal bone growth nga motubo sa atong dunggan is one of the causes of hearing impairment. Next is ruptured eardrum. Loud blast of noise, sudden changes in pressure, poking your eardrum with an object and infection can causes your eardrum to rupture and affect your hearing. A ruptured eardrum is a hole or tear in the thin tissue that separates the ear canal from the middle ear or eardrum. Another thing is that a ruptured eardrum can result in hearing loss. It can also make the middle ear vulnerable to infections. Some causes of ruptured eardrum is when we poke our ears with foreign objects such as cotton swab, a hairpin can puncture or tear the eardrums. A loud blast of noise katungog taog kusog nga pagbuto can cause hearing impairment. Kanang atong kulitogo na atong dunggan og bisong unsa samot na og hait. Yes, it can cause hearing impairment. However, a ruptured eardrums usually heals within a few weeks without treatment, but sometimes it requires a patch or surgical repair to heal. So that is the ruptured eardrum. Next possible cause of hearing impairment is damage to the inner ear. Aging and exposure to loud noise may cause wear and tear on the hairs or nerve cells in the cochlea that send sound signals to the brain. When these hairs or nerve cells are damaged or missing, electrical signals aren't transmitted as efficiently and hearing loss occurs. These hairs or cells, mura ni siya og kuryente, og naay ma-short circuit, naay mga damage dihang dapita, electrical signals di na matarong og transmit paingon sa atong utok, mauna nga di ta kaayo kadungog. Loud noise is particularly harmful to the inner ear. Again, a one-time exposure to extreme loud sound or listening to loud sounds for a long time can damage cells and membranes. Obviously, higher pitched tones may become muffled to you. Di ta kaayo kadungog og makalitan atong dunggan og makadungog og kanang mga kusog nga mga sounds. It may become difficult for you to pick out words against background noise. So those are the possible causes of hearing impairment. First is the gradual buildup of earwax, unti-unting pagbuo ng ating tutuli. Second is ear infections and abnormal bone growths or tumors. Third is ruptured eardrum. Fourth is the damage to the inner ear. So now, let's go on to the symptoms of hearing impairment. How do you know if you are suffering with hearing impairment? Now, here are the symptoms of hearing impairment. First is the muffling of speech and other sounds. Dili ta kayo kadungog, syempre. Next is difficulty understanding words, especially against background noise or in a crowd of people. Hindi na natin masyado na iintindihan ang mga salita, unlike sa normal nga pandungog. Third is frequently asking others to speak more slowly, clearly, and loudly. Ito ay kapag may nagsasalita at madalas na pinapaulit natin ang ating kausap at pinapalakasan nila ang kanilang boses para makarinig tayo. Ug nakakaana, simptomas na hearing impairment, something like that. So fourth is the withdrawal from conversations or hindi na masyado nakikipag-usap. That is one of the symptoms of hearing impairment. So again, muffling of speech and other sounds, difficulty understanding words, especially against the background noises or in a crowd of people. Third is frequently asking others to speak more slowly, clearly, and loudly, and withdrawal from conversations. Now let's go on to the risk factors of hearing impairment. So mauni ang mga risk factors in hearing loss. First is aging. Yes, exactly, aging. So if you notice, ang mga naaning mga hearing loss or hearing impairment are mga tiguwang. Kay mura na og appliances ba nga og magkadugay, magkahinay. So, risk factors is aging or pagkatigulang. Second is heredity or kaliwat. Your genetic makeup make you more susceptible to ear damage from sound or deterioration from aging. So, og na mo mga kaparyente nga mga na ay mga hearing impairment, kabahan ka na dahil ikaw ay isang risk factor of hearing loss. Charis. Third is occupational noises. Job where loud noise is a regular part of the working environment, such as farming, construction, or factory work, can lead to damage inside your ear. Example, og ikaw ay isang sundalo. Igsaba ka og gira. Now, itsahan man kag bomba, part na sa imong trabaho nga makadungog-zug ka og mga explosion of firearms, of bombs. Isa po na sa risk factors nga makuha nimo ang hearing impairment. Loud noise sa imong trabaho. Fourth risk factor is some medications. Drugs such as antibiotic gentamicin, sildenafil, Viagra, and other chemotherapy drugs can damage the inner ear. Temporary effects on your hearing is first is ringing in the ear or namagting ang atong dunggan or hearing loss kanang di natakadungog can occur if you take very high dosage of aspirin, other pain relievers, anti-malarial drugs or loop diuretics. So appeal pod ang pag-take og mga medicines nga high dosage isa sa risk factors in hearing loss. Yes, I have here na example ang akong kababata nga sa katong 2 years old pa siya, sige siya og kasakit dayon as in patumaron siya og mga high dosage nga mga tambal para lang maayo siya. So, yes, naayo siya pero ang kapalit nabungol siya. Hantod karon 20 years na iyang edad na siya yung pagkabungol. So those are the risk factors in hearing loss. Again, aging or ang pagkatigulang, heredity or ang kaliwat, occupational noises, mo na ang mga noises sa imuhang gitrabahoan. And fourth is some medications or katong pagtake og mga medicines nga high dosage. So now let's proceed to the psychological effects of hearing impairment. Unsa imong bation emotionally og nakay hearing impairment? So first is anger and denial. Losing your hearing can be a drastic change to your everyday life. That can be a difficult adjustment to get used to, causing feeling of anger. It is also common for people with hearing loss to be in denial about the severity of their hearing loss because it is a change that is hard to accept. Muna yung mga mahitabo og moabot ni nga sakita nga sa una wala ni nato. Again, kintay sa una sakto atong pandungog dayon kalit lang nga nawala atong pandungog or nihina atong pandungog tungod adtong mga rason kaya nawala imuhang pandungog. Yes, ang ako mabungol moabot jud ni naho nga I have this anger and denial. Mo jud ni natural jud ni feel nimo if moabot nimo ni nga impairment. So next is depression and anxiety. Losing your hearing can make you feel like you lost part of your identity and can cause feelings of sadness and depression. Yes. Symptoms of depression can include crying, slowed responses, weight changes, and disrupted sleeping patterns. Hearing loss can be also anxiety-provoking. So when people with hearing loss is faced with having a conversation with someone else, it can create lot of stress and worry that they are going to miss other parts of the conversation and let on that they are struggling to hear. Usahay, if maabot ni nimo ma-depress ka tungod kay naani mo ni nga sakit which is lisod man good og wala kay pandungog or hinay mong pagdungog. Ikaw ba naman nakay kay istorya pero it takes twice para lang makuha nimo ang isang istorya para lang madungog. It is also anxiety-provoking. Imulikay na lang ka tungod kay para lang dili ka maulaw. That is one of the psychological effects of hearing impairment, depression and anxiety. Next is isolation and social withdrawal. It is common to avoid situations where it is difficult to hear in order to avoid feelings of stress, anxiety, and embarrassment about your hearing loss. Mao nga uban mulikay na lang kay para dili mauwawan. According to Paul F. Farrell of Connect to Care, the frustration of not being able to hear in these situations may lead people to avoid going out in public or meeting up with family and friends, which can sadly cause them to become socially isolated. Mulikay na lang ka sa mga gatherings tungod kay di nimo gusto nga maulawan ka, especially og naka sa imong mga pamilya or reunion. Mulikay ka tungod kay maulawan ka nga ikaw hina imong pandungog, na-isolate ka, and na-ay social withdrawal. Next is fatigue. Losing your hearing can make you feel tired or fatigued because straining to hear properly demands more of your energy. Yes, og maglisod ka og dungog. Nimo yung pugson nga makadungog ka. That is a lot of demands of your energy. According to Rosanman Nesson, People with hearing loss often feel physically exhausted at the end of the day from the strain of trying to hear and make sense of what people are saying because all the additional work that is involved in hearing. Og maglisod ka og dungog, kinakapuyan. Mangita kag paagi unsaon nimo pag kasabot sa ilang istorya para lang makadungog ka. It demands more of your energy. Again, these are the psychological effects of hearing impairment. First is anger and denial. Second is depression and anxiety. Third is isolation and social withdrawal. And fourth is fatigue. I think katora ako ang part, the causes, the symptoms, risk factors, and psychological effects of hearing impairment. Thank you guys.
Hi, good day everyone. So I am Jill Miano and now I'm going to discuss to you my part. So my discussion will cover the topics learning characteristics, test and diagnosis, and treatments of learners with hearing impairments. So let's start with the learning characteristics. So hearing is one of the most important senses. Do you agree with that? I guess we all agree with that. So it is a vital part in the learning process. In fact, a study found out that 80% of education is received through hearing. Since much of learning is acquired through hearing, they said that students with hearing problems have deficiencies in language and in their experiences. Why is that? It is because of the diminished or lack of auditory responses to sound. They may miss out on daily conversations and they miss crucial information that non-hearing impaired students learn incidentally. Next is the language deficit can cause learning problems that can result in reduced academic achievement. Yes, no, so the limitation of spoken language by these learners can affect their learning outcomes because they may face different challenges in the classroom. Children with hearing loss may have problem with developing speech and language, including grammar and vocabulary, missing small words, and they also have a problem in spelling, reading, and being able to recognize the different sounds in words, or what is called phonemic awareness. Also, hearing sounds clearly enough to be able to tell small differences in words includes in the problems they faced. For example, differentiating the words talk versus top. So imagine yourself trying to learn a lesson in a classroom trapped inside a clear soundproof box, and the only way you can gather information is through your eyes or visually, and you will be tested on what you've learned or were supposed to have learned at the end of the day. Seem a bit unfair, isn't it? So a student with hearing impairment may not be able to catch up with all the topics the teacher has to discuss in front of the class, starting anything with the basics up to the complex mathematical equations. They understand concepts when the sentence structure is simpler, yes. Hearing loss makes it difficult to distinguish between certain sounds, is what I have said earlier. So it is difficult for them to distinguish between certain sounds in words, making speech comprehension difficult or in some cases impossible. In many cases, it is easier for a child with hearing loss to understand concrete words like dog, walk, and blue than more abstract words like after, from, and about. They also tend to have difficulty with homonyms like raise your left hand and dad left for the store. So if you can observe, or if you know someone who have a hearing impairment, they can understand better if you deliver your sentence word by word and not the usual or the normal way of conversation you have with a person with no hearing impairment. Next, communication difficulties may often lead to social isolation and poor self-concept. Yeah, so human interaction and support are aspects of the world which make life more comfortable and enjoyable. However, when the ability to hear and freely express your thoughts to the rest of the world isn't consistently possible, or it has limitation, this can put people to a position of isolation. So, mostly learners with hearing impairment choose to distance or to isolate themselves with their peers because it is hard for them to communicate or to even start a conversation with others. So they tend to distance themselves as different from the rest of their classmates. So next, most learners with difficulty hearing use various methods of communication. The most common is the use of hearing aids combined with lip reading. So we will tackle the different treatments or methods that will be used to address the problem of people with hearing impairments in our next slides. So next, they may overcome these problems by investing time, energy, and combined effort by both parents and educators. Yes, this is very important because what these children need are strong support system and full support from their loved ones and from the teachers or educators. What they need are understanding people around them, understanding their situations. Next is we have here the test and diagnosis. So first, we have the general screening test. So doctor may ask to cover one ear at a time to see how well hear words spoken at various volumes and you respond to other sounds. So there are various kinds of full hearing tests or general screening tests an audiologist can do to find out if a person has a hearing loss. It might include the ABR or the auditory brainstorm responses that checks their brain's response to sound. There is also what is called the otoacoustic emissions or OAE that checks the inner ear response to sound. And because this test doesn't rely on person's response behavior, the person being tested can be sound asleep during the test. We have here the tuning fork. So tuning forks are two-pronged metal instruments that produce sounds when struck. So tuning fork is used to differentiate between conductive and sensory neural hearing loss. Test is performed with different types of frequency and routine practices are used. Larger forks vibrate at slower frequency. Tuning fork is activated by striking against examiner's elbow, heel of hand, and placed 2 cm away from EAC for air conduction and on mastoid for bone conduction. So next, tuning fork evaluation may reveal whether hearing loss caused by damage to the vibrating part of middle ear, damage to sensors, or nerve of inner ear, or both. So we have here the audiometry test. So audiometry test is conducted by an audiologist where you wear earphones and hear sound directed to one ear at a time. The audiologist presents a range of sounds of various tones and asks you to indicate each time you hear the sound. So the audiologist will present various words to determine your hearing ability. Results from a hearing test are displayed on an audiogram. So an audiogram is a graph that shows the softest sounds a person can hear at different pitches or frequencies. The closer the marks are to the top of the graph, the softer the sounds that person can hear. Where the patient's results fall on the audiogram indicate the different degrees of hearing loss. So, for example, we have here normal. Normal means normal hearing range includes sounds as quiet as a top dripping leaves rustling on a tree in the wind or the sound of footsteps. So another is mild. Mild hearing loss means a person might struggle to hear some conversation, the sound of a clock ticking, or bird song. Is severe. So severe hearing loss could mean struggling to hear a dog barking, a baby crying, most conversation, or loud traffic. And the profound people with profound hearing loss will struggle to hear even the loudest sounds, including a jet engine or a pneumatic drill. Next, we have here the treatment. So treatment depends on the cause and severity of hearing loss. So we have here various options, which includes removing wax blockage, cleaning the outside of the ear by wiping with a cloth. You can clean the outside of the ear by wiping with a cloth, but don't wad up the cloth and push it into the ear canal. Next is removing wax blockage by putting serominolytic solutions. These are solutions to dissolve wax into the ear canal. So these solutions may include mineral oil, BB oil, glycerin, hydrogen peroxide or peroxide-based ear drops such as Debrox, and saline solution. With these solutions, you put a few drops into the affected ear with a dropper and lie on the opposite side so that the solution can drip into your affected ear. You can also soak a cotton ball and put it over the affected ear and let the solution drip into the ear. Another option is removing wax blockage by irrigating or syringing the ear. So this involves using a syringe to rinse out the ear canal with water or saline solution. Generally, this is done after the wax has been softened or dissolved by a semilytic. Next is removing wax blockage by manually using special instruments. So, your healthcare provider can remove the wax manually using special instruments. The provider might use a ceramine spoon, forceps, or suction device. Note that your ear should not be irrigated if you have or think you have a perforation or hole in your eardrum, or if you have tubes in the affected ears. Next treatment is the hearing aid. So, a hearing aid is a small electronic device that you wear in or behind your ear. It makes some sounds louder. A hearing aid can help people hear more in both quiet and noisy situations. So, hearing aids are primarily useful in improving the hearing and speech comprehension of people who have hearing loss that results from damage to small sensory cells in the inner ear, which is called hair cells. So, a hearing aid magnifies sound vibrations entering the air. So, it has parts. So, it includes the microphone, which detects the sound, the amplifier that makes the sound stronger, the battery that provides power to the electronic parts, and the volume control that increases or decreases the volume of the sound. And finally, we have the cochlear implant. This is a small, complex electronic device that can help to provide a sense of sound to a person who is profoundly deaf or severely hard of hearing. The implant consists of an external portion that sits behind the ear and a second portion that's surgically placed under the skin. So, hearing through a cochlear implant is different from normal hearing and takes time to learn or relearn. However, it allows many people to recognize warning signals, understand other sounds in the environment, and understand speech in person or over the telephone. So, hearing aids is very different from a cochlear implant. It is because hearing aids amplify sound so they may be detected by damaged ears, whereas cochlear implants bypass damaged portions of the ear and directly stimulate the auditory nerve. Signals generated by the implant are sent by way of the auditory nerve to the brain, which recognizes the signals as sound. I think that would be all for my discussion. Thank you so much for listening. Goodbye and God bless everyone.
Hello everyone. Before I start my discussion, I would like to introduce myself first. I am Brittany Lucica from Group 5. So now I'll be discussing the coping mechanisms, benefits for treatment, and prevention for hearing impairment. So, coping mechanisms. These tips can help you to communicate more easily despite your hearing loss. So first, position yourself to hear. For example, face the person you are talking to. So next, turn off background noise. For example, noise from a television may interfere with conversation. So next, ask others to speak clearly. So ask others to speak clearly but not more loudly. Most people will be helpful if they know you are having trouble hearing them. So it is important to tell your friends and family that to let them know that you have some hearing loss. So next, choose quiet settings. For example, in public, choose a place to talk that's away from noisy areas. Consider using an assistive listening device. So hearing devices such as TV listening systems or phone amplifying devices, smartphone or tablet apps, and closed circuit system in public places can help you hear better while decreasing other noises around you. So, there are numerous ways to treat hearing loss. Your treatment plan will be based on the specifics of your hearing loss type and severity. For many people, the best treatment option is some type of hearing aid or implant. However, some hearing loss can be treated with medical management. Additionally, some hearing loss is temporary and may get better with time. For this to be case, the problem usually needs to be identified and addressed early. If you are experiencing some sort of hearing loss, don't hesitate to tell your doctor or a hearing specialist. With testing, a treatment plan can be developed to either reverse or mitigate the impacts of hearing loss. However, timeliness can be very important, even if the hearing impairment seems minor. Seeking help with your hearing loss is strongly advised. These are some of the advantages of hearing loss treatment. So first, the physical. People with untreated hearing loss are more likely to experience falls or otherwise have accidents. Wearing hearing aids can help people with hearing loss enjoy safer, healthier, and more independent lifestyles. So second, mental. Hearing loss can have significant mental health impacts. It can cause feelings of isolation and other negative emotions. However, treating hearing loss can significantly improve these issues. So third, emotional. People with hearing loss are more likely to have a hard time connecting with others. They can feel less socially engaged, even with loved ones and close friends. Furthermore, they may miss out on significant moments due to being unable to hear. Wearing hearing aids or otherwise treating hearing loss can help people to enjoy more emotionally fulfilling lives. Benefits of treatments. So first, greater self-confidence. Many people with hearing loss experience a drop in self-esteem and confidence because of their impaired ability to communicate with other people. Having hearing loss can also limit one's ability to learn to speak a new language. So with the help of treatment, it will boost their self-confidence. They can feel the urge to communicate others clearly because they are already treated. And they will never look down on themselves because of the disability they had. Second, closer relationships with loved ones. So we all know that people who have experienced these kinds of hearing disability feel down, belittle themselves, and sometimes distance and isolate themselves because they feel ashamed to have this kind of disability. However, because of the support and love that their loved ones have offered to them, it will lead to a closer relationship because the only person they can trust and love is their family or friends who can understand and love them unconditionally despite the disability. So third, improve outlook in life. If you struggle with a hearing disability that impacts your quality of life, one of the best things you can do is seek treatment. Treating a person with hearing disability can lead to a healthier and happier outlook on life. They will no longer feel ashamed because of the treatment they had. So, what to do if you are concerned your child has hearing loss? So first, all babies should have a hearing screening by 1 month of age. A screening is painless and can be done while the baby is sleeping. Then all children should have their hearing tested before entering school or any time there is a concern about a child's hearing. Speak with your child's pediatrician if you think a hearing test is needed. 4 tips to prevent hearing loss in your child. So first, have a healthy lifestyle during pregnancy, including routine prenatal care. So please avoid eating unhealthy foods or taking drugs like that nga maka-affect sa baby. Then second, And make sure your child gets all regular childhood vaccines. So next, keep your child away from loud noises. Noise, induced or acquired, hearing loss is permanent and is always preventable. It is caused by prolonged or repeated exposure to any loud noise over 85 decibels, which is the loudness of sound measured in units called decibels or dB. So, fourth, create a quiet home. For example, set your TV or video game volume to the lowest volume that can still be heard clearly. Then, if you live in a noisy location, keep windows and doors closed to minimize potentially harmful outside sounds. Use soft inside furnishings, more curtains, cushions, and carpets that will absorb more sounds. So other example is that encourage children to use earplugs or earmuffs if exposure to potentially harmful sounds like fireworks and music concerts. Then power tools like that. These tips are the best way to prevent acquired hearing loss starting as early as today. You can begin creating a quieter home and taking action in preventing hearing loss from affecting your child and family. Prevention for hearing impairment. Protect your ears in the workplace. Especially designed earmuffs that resemble earphones can protect your ears by bringing most loud sounds down to an acceptable level. So this is the earmuffs. Earmuffs are clothing accessories or personal protective equipment designed to cover a person's ears for hearing protection or warmth. For example, we all know that the environment for construction workers is very noisy. This is why construction workers should always wear ear protection if they are using loud machines. Thus, hearing protection device reduce the amount of noise energy reaching and causing damage to the inner ear. So this is the custom molded earplugs, silicone earplugs that are molded by the user in the ear canal, ensuring a personalized fit. They can be used as hearing conversation measures in workplace where ear protection is required. Since we have different ear sizes, it's better to visit your doctor to custom molded earplugs. You can have them especially created with filters to determine the amount of noise reduction you want. Most earplugs are able to provide about 25 to 30 decibels of noise reduction, but you have the option of adding filters to provide even more protection. Then, next, have your hearing tested. Consider regular hearing test if you work in a noisy environment. Regular testing of your ears can provide early detection of hearing loss. Many areas of normal life can be affected by hearing trouble. So, it is important to have your hearing tested because it is essential that you establish a good relationship with your hearing health provider if you want to remain unaffected by these problems. Also, it is helpful to know if we are already affected or not so that we can find ways to avoid hearing loss. As they say, prevention is better than cure. So next, avoid recreational risk. First, some activities, hunting and listening to extremely loud music for a long period of time can damage your hearing. Then, wearing hearing protectors or taking breaks from the noise during loud recreational activities can protect your ears. Then, turning down the volume while listening to music can help you avoid damage to your hearing. So it's better to increase the distance between you and the source of the noise. Reduce your time in noisy areas and always wear hearing protection in noisy areas. Just like what I said earlier, you must consider using ear muffs and custom molded earplugs. And if using foam plugs, insert them correctly. If you don't have a budget, it is better to be aware and avoid those activities that can cause hearing loss. Also, if you are listening to music or something else, keep the volume at a safe level and only listen in areas that are not noisy. We must consider also the warning sign that pops in our phone or other gadgets, like just like a high volume can damage your ear like that, especially when hearing a headset. So makabantay man tanot nga ato ang pakusgan ang ato ang earphone or headset na maging mo pop nga warning sign. So dapat ato ginang sundon. So that's all. Thank you, and I hope you learned something in my discussion.
So, general educational adaptation for learners with difficulty hearing. So, when we talk about adaptation, it is a description of the changes in general and special education that are needed for student to meet his or her goals and objectives. So, why is it important? Adaptation encourage the inclusion of all students by addressing individual learning styles and needs. So this promotes diversity within the school environments and enables all students to feel successful in school. So how should deaf students be taught? So ang sama na to pagtudlo ang mga bata nga may problema sa pagpanungog. So deaf children in mainstream schools face challenges to their learning which their hearing peers don't experience. Yes, teachers with deaf students in their class needs to use inclusive strategies to assist their learning. So here are seven teaching strategies that will help empower your deaf students to do their best in school and set them up for success in their future workplace. So first is ensure there is a clear line of sight. So you can help your hard-hearing students by inviting them to sit the front of the classroom if they want to. Dili nimo pugson. So if your students is using an interpreter or relying on lip reading, so when we talk about lip reading is kanang ang bata is mo estudyante is nagtanaw lang sa imong baba or any visual clues or a hearing aid. So being closer to the front will help them learn. So ensure you are facing at the classroom when you speak. Yes, if you speak and you know you have students who can't hear, so you should face to the class, not on the whiteboard. So good lighting is also a must so they can see you clearly. Speak normally and clearly, emphasizing keywords, repeat, rephrase when necessary. So if you're kanang nag-organize ka kanang group activity, paningkamuti nga ang position sa mga imong estudyante is naka-circular. Kaya ron makita sa mga deaf learner ang mga lips sa mga classmate niya. Kaya ang gamiton niya na is lip reading man. So next strategy is provide written handouts and visual aids. So deaf learners who are lip reading, watching an interpreter or using a hearing aid may find it difficult to take notes from a whiteboard at the same time. So your deaf students don't miss anything important. So you should make all information and announcement from class available as a written handout. So visual aids and learning materials are a great way to support deaf learners, but it's important not to rush through visual content, particularly when you're speaking at the same time. So hinay-hinay lang. Kaya i-process mo po na silang una-una. So give your learners time to look at the visual content and take it in before you start speaking. So kay kana mo sa they need time to switch from visual to auditory. Then Next strategy is show captioned or interpreted video. So if you are using a video as part of your class teaching, so try to find captioned or sign language interpreted options. If these aren't available, consider how else to engage your deaf student with learning material in the video. So the most important thing for teachers is to be as inclusive as possible every step along the deaf learner's journey. So dapat panikamutan dyan mga inclusive jud. So next strategy is reduce background noise. So for students who are using hearing aids o banha kayo, sakit yun na sinandunggan. So panikamutan nimo nga ma-reduce ang amount of background noise in the room. Pero kani easier said than done lang siya in some noisy classrooms. So besides managing students' behavior, so however, think of other ways you can limit ug di lang jud mapungan paning kamot mangitag pagi nga kanang malimit lang jud ang banha sa imong room. Kanang can you close the windows and doors for example? So ano nga pinapolite nga kuan ba nga way. Then clearly repeating question or response from other students in the class will help your deaf learners understand what their classmates are saying. So you want your deaf and hard-hearing students to feel included in your class conversations. So mangutana ka nga how they will feel most comfortable participating in your class discussion. Paningkamutan dyan mga walay mga estudyante nga ma-left behind. Next strategy is use available resources. So you could consider learning sign language and encourage other class members to learn sign language too. So additionally, you can use the technology available to assist deaf learners. So as not new technology, na natadagan technology about any mga deaf learners. So for example, if possible, allow deaf students to record the lesson with remote captioning or provide a recording of the lesson yourself so that a transcript can be made available later. Next is check in with your deaf students. So make sure nga mga estudyante nimo nga pakaibaw nga naka pa nga motudlo nila according to strategies whatever they feel comfortable with. So respecting their choices is important. You want to help empower them to be the best learners they can be. So before, during, and after a lesson, check they have understood what you are teaching and repeat anything they ask you to repeat. Ug nagali sila dili masabtan, um, i-repeat hantod nga masabtan na dyan nila. So next is the seventh learning strategies is adapt your teaching for distance learning strategies. So well, online learning originally called as the remote learning, is far from a new concept. So when COVID-19 strikes or the pandemic has forced many teachers to rapidly adapt their in-class teaching, so methods to help students learning from home. So the lack of face-to-face communication has, however, added another barrier to the deaf community. Yes, naka-add na siya barriers sa mga deaf community in accessing information and feeling connected, relevant for distance learning. If you are teaching via Zoom, for example, it's important to ensure the lighting is good. So set yourself up in a quiet area to reduce the background noise that could interfere with closed captioning or transcripts. So that's it. So the instructional strategies the teacher may use in order to deliver the right thought for deaf students. First is the classroom adaptations. So it is a few steps can be taken to ensure the classroom is suitable for hearing impaired students. So when possible, paningkamutan nimo nga ma-off ang equipment that creates background noises such as fans and projectors when not in use, or paningkamutan sa teachers nga ang classroom is conducive for learning. Next is the communication considerations. For example, look directly at the student and face him or her when communicating or teaching. Pero don't exaggerate your lips. Kay ang mga bata mo gud nagtan-aw sa lips nimo para makasabot sila sa lesson or paningkamutan ni mga slow ang pag-istorya kay makatabang po ni sa mga bata ang masabtan nila aron di pa sila maglibog. And you may use facial expressions, gestures, and body language to help convey your message, but don't overdo it. So some communication may be difficult for the hard of hearing student to understand. Explicitly teach idioms and explain jokes and sarcasms. So young hearing impaired children often lag in the development of social graces. So you should consider teaching specific social skills such as joining into games or conversation, maintaining conversation and staying on topic. Next is visual strategies and curriculum accommodations. So example, you will provide an outline of the daily lesson and printed copies of the notes, so allowing them to focus on discussions and questions while you are teaching. Na ang pasabot ni is mag-provide ka og mga handouts after nimo mag-teach kay aron maka-focus lang dyan mga bata nimo sa pagpaminaw sa imong gi-discuss, and students can be more engaged in learning and can easily review the notes at a later time. So since vision becomes a hearing impaired students, primarily means for receiving information, utilize visual aids whenever you can consider using. You may use poster, flashcards, pictures, manipulatives, graphic organizers, artifacts, or any visual items to illustrate concepts. So if ganahan jud ka mag-teach og ganang sa pina news style like video, so you may use caption video in class and follow all established guidelines within the student's IEP, or what we call the individualized educational plan. So regarding classroom adaptations and aids for hearing impaired students, don't be afraid to contact your higher ups of Nagagay Libugan. Next is regular educational um, evaluation of progress. It is critical for teachers to monitor the progress and understanding of all students, but especially for those with special needs. So teachers must be sensitive to the needs of hearing impaired students and follow the IEP as close as possible. Dapat mo stick lang juga sa IEP. Next is expect success. So teaching hearing impaired students doesn't have to be difficult. No need lang ni siya lisod-lisoron kay nangkamot ka na sila nga makakaton sa imong mga gipang discuss. So as long as you're flexible, good na siya as a teacher. Pero mo lang na kay paningkamutan lang mga bakit pagi nga dali ra makatunan sa imong mga estudyante. So when you incorporate these strategies into your teaching practice, chances are that you'll find a number of students who can benefit from your efforts. So before I end this discussion, I will leave you a quote by Barbara Coloros saying, "If kids come to us from strong, healthy, and good functioning families, it makes our job easier. If they do not come to us from strong, healthy, and good functioning families, it makes our job more important." Thank you and have a nice day forward.